Hey, welcome to the Go-To Physio Sports Massage series. In today's lesson, we're going to have a look at low back mobilization techniques. Now, as always, please respect the 80-20 rule. We're going to spend 20% of our time desensitizing the tissues. We want to spend 80% of our time giving a graded exposure, low tolerance through our rehab and movement techniques to get long-lasting changes. If you find your patients are leaving feeling great, but they're coming back again and the symptoms have returned, then we probably haven't found a true cause. For that, head over to www.thegotofysio.com. I've got loads of resources there to help you become that go-to therapist. Now, a word of warning with the low back, please use these techniques responsibly. I'm not a massive fan of massaging the low back. I think sometimes it can do a little bit more harm than good when we leave these areas feeling a little bit loose when we haven't got that graded exposure program. With that said, there is a couple of techniques that I use sometimes that are very, very powerful. Use them responsibly, and when used with the 80-20 rule, you will get great results. So with that said, let's get into the content and I'll see you on the other side. Okay, so for the lower back, I'm not a massive fan of treating the low back with massage just for the sake of it. So again, we need to understand that if the person has pain here, okay, that, why does the person have excessive forces maybe going through these tissues that's ultimately contributed to this maybe noxious stimulus, which is then being interpreted by the higher centers into this conscious pain experience. So saying that, I may choose to do some kind of soft tissue work, especially around the intercostals here and the paraspinals. I may be going into the lateral obliques as well, okay? The one thing is, you just need to understand is that the QL is actually quite deep here, okay? So again, sticking your elbow in here, I'd question whether we genuinely are on the QL or not, okay? So it attaches quite deep to the spine here and it goes down into the iliac crest here. But very often what you will be influencing here as well will be the kind of oblique attachments, okay? So if you are getting some kind of improvement here, or they do have some kind of pain here, sometimes it can be an intercostal type issue, or it can be some kind of attachment to the obliques, which may be contributing to this pain experience, okay? So what I would do in this scenario with the back is I may just, again, go across the body, stabilize my hand. I'm in a strong, powerful position, and I just sink into the tissue, and then I would just follow around here, okay? So again, sink and just follow through, and again, I'm probably more so on the oblique tissues, and obviously there's some adipose tissue and skin here, etc. as well, okay? So you can get into the kind of the lateral border of the lower back if you want. Again, try avoid just digging your elbow in for the sake of it. I was guilty of that when I first started out. Again, you just get some nice depth here. You also get the proximal glute here as well as you come through, okay? And then if I want to get the rest of the back, then it's very, very simple. Again, I'm in a strong lunge position and I'm just going to follow through, and my back leg is pushing through all the time, okay? So again, I would have oil on the patient here. I'm just sinking through and just coming through here, okay? And then you can do it on the same side if that feels more comfortable. And again, just working those paraspinals and just coming through it, and it's pretty effortless for me. So I would like to stay away from the spine when I do treat this, okay? So I don't mind treating the iliocostalis, etc. to bring about some kind of protective tone around here, but I try not to dig into the actual lower back as well, because I said a lot of people, they can be quite sensitive here, and the last thing I want to do is leave them feeling loosey-goosey without earning the right to actually have that freedom, okay? So again, you have to ask myself, why is this tissue in protective tone? And if I release this protective tone, okay, what may be the consequences of that, okay? So again, I always see it as I have to put back something into the system before I take something away, okay? So if I want that low back to relax, very often for me, if I can improve the motor output through here or in the obliques or something like that, then very often the protective tone will change very, very quickly. But what I don't want to do is try to change that protective tone myself without giving anything back, okay? And I always say to the person, the nervous system will appreciate it rather than it being given. Okay, and as always, I want to ask myself, okay, why is that lower back tissues carrying so much protective tone at the moment, okay? So again, it may be worthwhile improving the motor output through here, through the obliques, etc., which will help then maybe release or relax that protective tone a little bit more, rather than trying to do it with just my hands-on technique, okay? And I always say to the patient, the brain will always appreciate it more when it earns it rather than it being given, okay? So if it's given something for free, I don't think we appreciate it as much as if we've had to earn it. So if the person can get that low back to relax by getting other tissues to do their job, then that to me is maybe a better use for time. But certainly for this one, again, just going through here, you know, you can get quite a lot of work done, you know, to these tissues here with those kind of techniques, okay? So again, just make sure you're talking and communicating to the person throughout. Make sure that they're breathing well, they're not stiff and tense, the low traps. They're going to be a good inclination as well of actually if they're tensing, okay? So keep an eye on the tone of the traps while you're doing your lower back work.